On the line with us is Dr. Zeke Emanuel. He's an oncologist and bioethicist, the senior fellow for the Center for American Progress, currently the vice provost of global initiatives at the University of Pennsylvania, and the chair of the Department of Medical Ethics and Health Policy. EzekielEmanuel.com is his website. Dr. Emanuel, welcome back to the program. It's been a while, but welcome back. We've got more cases of Wuhan virus now than we had SARS. It doesn't have as high a mortality rate. And then there's this piece in Lancet that was published 3 days ago about this 10-year-old boy who is shedding virus like crazy and is completely asymptomatic. And Germany just reported the first confirmed person-to-person transmission of an asymptomatic person. A woman came from China, attended a business meeting there, and one of the people in that meeting, and she was completely asymptomatic. One of the people in that meeting is now infected with this. And apparently a lot of the people who actually have the infection prior to their becoming symptomatic have no fever whatsoever. What do we know about this beyond what I've said? And did I say anything that's wrong?
No, so far you've said everything that's right. I do think, there is a worrisome factor that, you can spread this while being asymptomatic, and that does make it harder to screen people and know who should be, quarantined or restricted access.
Is that different from the common cold and the flu?
Well, but the common cold and the flu, as you correctly point out, have a much lower mortality index, and many infectious diseases, you are asymptomatic for a while, and you can spread it in that asymptomatic phase. I do think we need to put this somewhat into context, which is, this likely to spread. It's going to get worse before it gets better, and we know that there are going to be people who unfortunately die from this. But is this likely to break out into some major pandemic around the world? Unlikely. We're likely to be able to contain it. Obviously, it would have been better had we done some more containment earlier on, and the Chinese been a little more open earlier on. But these kind of things are often hard to figure out what the right measure is, especially when you don't know how severe it's going to be right at the start.
Right.
But I would put in context, we have tens of thousands of people in the United States who die every year from the flu. We have a vaccine, and yet we struggle to get 50% of the adult population to get vaccinated.
Right, and 35,000 people.
Whatever this is, whatever this coronavirus is, it's very, 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 very unlikely to be that severe. And yet our response, because it's new and novel, tends to be much more histrionic, I think, than it is. We live with the flu. It's just the flu. Well, it is just the flu, but it also kills a lot of people. It may not kill at the same high rate, but it does happen to kill tens of thousands of Americans, and your chance of getting it from colleagues are low. And again, these viruses, droplets, getting them on your hands, taking your hands and bringing it to your face and getting yourself infected. That's the common path. And so there are things we can do to try to prevent transmission.
Yeah. There was a fascinating op-ed in the Washington Post, I believe it was, by an ER doc who was living in Beijing during the SARS outbreak. And she kept her kids in the public school, and they started this policy of everybody wash your hands all the time, because apparently the transmission of coronaviruses like SARS and this new one and the common cold, for that matter, isn't so much through the air like the influenza is. When the air is very dry, the flu virus floats around in the air for a while. But apparently it's touching surfaces, and then, like you said, touching your face or your mouth or nose.
Yeah.
And she said that they started just, rigorously washing their hands, semi-obsessively, and the result was that not only did nobody get SARS, even though there was one case right where she lived, nobody got SARS, but in addition to that, the rate of common colds in this school just collapsed. And so, this may be, we don't need face masks, we need to wash our hands. Is that the bottom line here? Assuming that it gets here?
we need to be more scrupulous about it. And I would say, first of all, we should not be hysterical that every person with a fever or every person who's been to China has this. And I think that, a little rationality. China is a country of 1.4 billion people, and we're talking about, say, 4,000 or 5,000 people documented. Say this rate is even 100 times that. We're talking 400,000 or 500,000 people, right? That's 0.01% or 0.03% of the entire Chinese population. It's a tiny, tiny amount. Now, that doesn't mean we should put our guard down. That doesn't mean we shouldn't worry about this and have our healthcare, public health experts out there. But we should do the rational thing. And we know that, washing your hands and not putting your hands on your face as frequently as we do, very important to control these kinds of infections. So I think tone down the hysterical response and tone up the rational response. And by the way, if you haven't gotten the flu vaccine, that would be a good thing too.
Yes, absolutely. Two other data points here that I'd love to get your thoughts on, and then we're going to hit a hard break in about 2 minutes. Rear Admiral Timothy Zimmer was the Senior Director for Global Health Security and Biodefense at the National Security Council. He was
Zimmer, great man.
Right, and he was put into place after the Ebola thing, and he was basically in charge of America's response to epidemic diseases. He was fired or removed from his office by John Bolton, actually, and has not been replaced. So we have nobody in charge of epidemic responses in the White House right now. And we are the only developed country in the entire world that does not have a national health care infrastructure, a national health care system. How vulnerable do those two factors make us?
Well, I actually recommended Tim Zimmer for his job in the White House with President Trump because I thought he was a tremendous man. He ran malaria response before that, and it is a mistake not to have someone in the House, in the White House. Things come up under the Obama administration. We had H1N1 in the early years, 2009, 2010, that we had to respond to, and you need someone who can coordinate that response and get our best people. Fortunately, the United States does have the CDC, very competent. It does have Tony Fauci and the National Institute of Allergy and Infectious Disease, again, competent response. It would be better to have it coordinated centrally at the White House that can talk to every agency and private industry as we need them to respond to this. But we already have, people working on a vaccine. We do have a reasonably good infrastructure. As you say, not having universal health care coverage probably impedes our response. God forbid we have a pandemic.
That was my concern.
Coronavirus or of the flu.
Right. We've got 30 million people who are uninsured, and we've got at least 150 million people who postpone going to the doctor because they're concerned about the expense of a copay.
You and I are in heated agreement about this problem.
Yeah. Okay.
That is a gap in our ability to respond, and this is unlikely to be a major issue, this coronavirus. But our ability to respond to some pandemic or some issue is seriously impeded when people are worried. Oh, maybe I won't go to the doctor because I have symptoms, but I can't afford to show up at the urgent care, the primary care doctor, or the emergency room. That is not a good place for us to be.